Hello everyone. In this video, let's analyze the concept of herd immunity. While most of the countries in the world close their borders, stop the movement of people within their countries, and impose strict restrictions on their residents, Sweden has followed a quite different approach by imposing minimum restrictions. It adopted a model called herd immunity. What is herd immunity? Herd immunity, also called community immunity, is a form of indirect protection from infectious disease that is achieved when majority of population develops resistance to a highly contagious disease. The idea is that when enough people in a population are immune to a disease, they can indirectly protect the people who aren't immune. When greater the proportion of immune individuals in a community, the smaller the probability that non-immune individuals will come in contact with infectious individuals. This helps in breaking the vicious chain of infection or may help in slowing down its spread. Let's see how herd immunity works through this picture. When a novel pathogen is introduced to a community, it spreads as no one is immune to it. After some period, people who recovered from this disease develop immunity. And when sufficient portion of community is immune, pathogen can't find new hosts and stop spreading. This breaks the chain of infection. When do we achieve herd immunity? Mathematically, it is defined on a basis of a number called herd immunity threshold, which is number of immune individuals above which a disease may no longer circulate. It depends upon the reproductive number of a particular disease. Reproductive number means how many persons will be infected by a single infected person. The higher the reproductive number, the higher the percentage of the population that has to be immunized to achieve herd immunity. For example, for polio, the herd immunity threshold is 80 to 85%. This means that 80 to 85% of the population needs to develop immunity to achieve herd immunity. Herd immunity for corona. Herd immunity can be achieved in two ways. The first way is through mass vaccinations and the second way is through infections. That is, when people contract disease, they build up an immune response to it. As there isn't yet a vaccine for corona, the only way to achieve herd immunity is through second way, that is through infections. The estimated herd immunity threshold for corona is 60 to 70%. That means 60 to 70% of a population needs to be immunized to achieve herd immunity. Risk involved. Vaccinations are the safest way to achieve herd immunity, but there isn't yet a vaccine for corona. Second, the need to protect the vulnerable populations of a country as they are at a greater risk because it may take months or even longer to achieve herd immunity, and this sudden boom in infections may overwhelm the healthcare systems. And the behavior of pathogen is still unclear. There isn't yet enough statistical data to estimate the reproductive number of corona. Moreover, it is still unclear whether one can become immune to the virus, nor it is clear whether a person who develops immunity will remain permanently immune. Another risk is relapse of infections, where infected person is getting infected again. Moreover, the effectiveness of this strategy depends upon the population structure of that country. Why effective in Sweden? This no lockdown strategy worked in Sweden because its government responded very early and managed to get old, babies and vulnerable stay back at home. It followed strict social distancing and PPE norms, as social distancing is not a new concept to Sweden. And more than half of Sweden's population live in single-person households. Another reason for the success of Sweden's strategy is because the trust between the government and the people, as it is law-abiding, educated, non-religious and science-trusting society. This picture shows how people of Sweden follow social distancing. Criticism against Sweden's strategy. Initially, the death rate in Sweden was almost 3 times higher than other Scandinavian countries, and it is nowhere near the threshold needed to achieve herd immunity. It is also criticized for high rates of infections and deaths in elderly homes. Sweden's argument. It followed this no lockdown strategy because lockdowns are not sustainable for longer periods. Though it is criticized for death rate, which is initially high, it managed to slow down its death. According to its argument, if herd immunity is achieved across Sweden, it will be in a strong position to return to relative normality. But in comparison, other countries could face further lockdowns to prevent the spread of virus until a vaccine is found. And by following this strategy, it managed to maintain some economic normalcy, and moreover there will be no debate in Sweden how to reopen the economy and how to tackle the second wave of infections. This chart shows daily new deaths in Sweden. Though deaths were initially high during month of April, Sweden managed to slow down its trajectory, as we can see in the month of June. Let's see whether this strategy works for India or not. Initially, it was argued that this strategy cannot be emulated in India because majority of young Indian population have high rates of comorbidities and risk. That is, nearly 40% of Indian adults aged 45 to 54 years and 22% of those aged between 20 to 44 years have hypertension. And nearly 4% of adults aged between 15 to 44 years have reported type 2 diabetes. Following this strategy could lead to increased hospitalizations that could overwhelm the healthcare system of country. And moreover, it is unclear how long immunity lasts and whether reinfection is possible or not. Another reason is poor public healthcare infrastructure, because India has only 0.55 hospital beds per thousand population and 48,000 ventilators for a population of 1.3 billion. With this, it may not be possible for India to manage a crisis like corona. Present situation. Though these arguments were initially true, but no country can afford prolonged lockdowns, especially a country like India. India had the most stringent coronavirus lockdown, but despite this, cases kept increasing, which had a serious economic impact on the country. Realizing this impact, government has recently eased restrictions despite the cases kept increasing exponentially, and this may be an indirect indication of government trying to prepare the country to achieve herd immunity. However, Indian government has not indicated any plans to adopt herd immunity. At present, the only possible solution that India have is to follow the strategy of herd immunity combined with targeted medical care of serious patients and educating the people on how to learn to live with the virus by following a social distancing and sanitation norms. Thanks for watching. Have a great day.